If you're over 60 and your doctor is still ordering these 5 tests, I need you to stop and watch this, because some of what's considered routine screening after 60 can actually do more harm than good. I've spent decades in medicine, and there are checkups I personally would never agree to at this stage of life. Today, I'm telling you exactly what they are. Now, I know that sounds alarming. We're taught from a young age that more testing means more safety, that checking everything all the time keeps us protected. But here's what they don't tell you in the waiting room. After 60, certain screenings carry risks that quietly outweigh their benefits. False positives that lead to invasive procedures, unnecessary biopsies, medications prescribed off results that were never going to hurt you in the first place. I had a patient, I'll call her Margaret, 68 years old, healthy, active, sharp as a tack. She went in for a routine screening her insurance flagged as recommended, and what followed was 6 months of follow-up tests, anxiety, and a procedure she never needed. Not because her doctor was careless, because the guidelines most doctors follow haven't caught up with what the research is now telling us. If this is something you or someone you love needs to hear, please share this video right now. It could genuinely change someone's health decisions. And if you haven't already, subscribe to this channel and hit that notification bell, so you never miss the information that your doctor's appointment simply doesn't have time to cover. Stay with me and please watch till the end because what's coming might genuinely surprise you. I'm Dr. Sam Hartley, a medical doctor with over 25 years' experience helping and supporting patients live longer and stronger. Let's get started. Before we get to the list, I need to give you one concept because without it, everything I'm about to say will only half make sense. I call it the screening math. And after 60, that math changes completely. When you're 50, screening medicine works beautifully. You find a problem early, you treat it, and you potentially buy yourself 30 more healthy years. The investment pays off. The maths is clean. But after 60, 3 things shift. First, many conditions that routine screening picks up in older adults grow so slowly that they will never cause you any harm in your remaining lifetime. Your body would have quietly outlived them. But once they show up on a report, medicine doesn't have a leave it alone and watch button. It has a treatment button. Second, your body's tolerance for intervention drops as the years go on. A surgery that a 55-year-old bounces back from in 2 weeks, that same surgery at 78 can mean months of recovery, complications, and a quality of life that never fully returns. And third, this is the one nobody talks about, the cascade effect. One test finds a small abnormality. That triggers a follow-up scan. The scan flags something. That leads to a biopsy. The biopsy leads to a procedure. The procedure causes a complication. And suddenly, the person who walked in feeling perfectly well is navigating a medical crisis that started with a test they didn't actually need. That is the screening math. Keep it in your mind as we go through each one. Checkup number 1. Routine colonoscopy after 75. Let me tell you about Dorothy. Dorothy was 77 years old. A retired librarian from a small town, sharp, independent, walked every single morning. She'd had 2 clean colonoscopies in her 50s and 60s. No polyps. No family history. No symptoms whatsoever. Her new GP looked at her chart and said she was due for another one. Dorothy had her doubts. But she didn't want to seem difficult, so she went. The preparation, the liquid you drink the night before to clear your bowels, hit her kidneys like a truck. By the next morning, she was dizzy, confused, barely able to stand. Her daughter rushed her to the emergency room before she ever reached the procedure. She was severely dehydrated. Her electrolytes were dangerously low. Her heart was at risk. Dorothy spent 4 days in hospital. She never had the colonoscopy. And here's the painful irony. She didn't need it. The United States Preventive Services Task Force, the gold standard body that sets screening guidelines, officially recommends against routine colonoscopy screening for average-risk adults over the age of 75. The evidence is clear. After 75, if you have no symptoms, no family history, and previous clean scopes, the risks begin to outweigh the benefits. And those risks are real. Bowel perforation, a literal tear in your colon, occurs in roughly 1 in every 500 procedures. In a younger adult, that's a manageable complication. In a 77-year-old, it can mean emergency surgery, a colostomy bag, months in hospital, and a recovery that fundamentally changes your quality of life. Meanwhile, colon cancers most likely to be found in asymptomatic older adults tend to grow slowly enough that in many cases, they would never cause any problem in a person's remaining lifetime. So what do I recommend instead? Ask your doctor about a non-invasive stool-based test like the Cologuard or the annual FIT test. These can flag genuine warning signs without the procedural risks. And if you do have symptoms, blood in your stool, unexplained changes in bowel habits, that changes the equation entirely. See your doctor immediately. Symptoms change everything. What we're talking about here is routine, asymptomatic screening. Checkup number 2. Aggressive cancer screening in your late 70s. I want to be very precise here, because this topic deserves care. I am not saying never screen for cancer. Cancer screening has saved millions of lives, and it can absolutely save yours. What I am saying is this: after 75, aggressive cancer screening in average risk, asymptomatic individuals has a serious overdiagnosis problem. And overdiagnosis leads directly to overtreatment. Here's what overdiagnosis means in plain terms. Imaging technology today is so sensitive that it can detect cancers that are, biologically speaking, barely awake. Tiny, slow-growing tumors that, left alone, would never spread, never cause a symptom, and never shorten your life. You would die with them, not from them. But the moment a radiologist writes the word malignancy on a report, the clinical machine turns on. Biopsies, specialist referrals, treatment decisions, all of it moves forward regardless of whether the cancer actually poses a real threat to you. Let me tell you about Richard. 79 years old, retired, still fishing on weekends. A routine PSA test came back slightly elevated. Biopsy confirmed a low-grade, slow-moving prostate cancer. His urologist recommended radiation therapy. Richard trusted the recommendation and went through with it. Within a year, he was dealing with chronic fatigue, urinary problems, and a quality of life that had dropped dramatically. His cancer was almost certainly the kind that a man his age would have lived alongside quietly, and never died from. Studies in the New England Journal of Medicine found that a substantial portion of cancers detected through mammography in women over 70 were clinically insignificant, meaning treatment offered no survival benefit, only side effects. So what do I recommend instead? Have an honest conversation with your doctor about your specific risk profile. If you have a family history, genetic markers, or symptoms, screen. If you're average risk with no symptoms, ask directly. If we find something, what are the realistic treatment options at my age? And would that treatment genuinely improve my life? That question alone often changes the entire conversation. Mid-video. Before we go further, if you're finding this useful, there are 2 things I'd love you to do right now. First, hit the like button. It genuinely helps this information reach more people who need it. And second, if you have a friend or family member over 60 who goes to every routine screening without question, share this with them. You might just save them from a procedure they never needed. Right, let's keep going. Because number 3 on this list is the one that surprises people the most. Checkup number 3, routine cardiac stress testing without symptoms. This one catches people off guard because it sounds so responsible. Your doctor says, you're 72. Let's just make sure your heart is doing okay. You hop on a treadmill or they give you a medication that temporarily stresses your heart and monitor the response. Sounds sensible. Sounds proactive. What could possibly go wrong? Here's the problem. Cardiac stress tests in people without symptoms have false positive rates that can reach 40% or higher in certain populations. That means nearly half the time, the test flags a problem when your heart is actually completely fine. But medicine can't simply shrug at an abnormal result. That false alarm launches you into the next phase, a cardiac catheterization, where doctors thread a thin tube through your blood vessels, through your wrist or groin, directly into your heart. It is a serious procedure with real risks: bleeding, vessel damage, arrhythmia, and in rare cases it can trigger the very heart attack or stroke you were trying to prevent. And if the catheterization finds a partial blockage, which is extremely common in anyone over 70, you may end up with a cardiac stent. Here's what multiple landmark clinical trials found, including the widely cited ischemia trial. Stenting in patients with stable coronary artery disease did not reduce heart attacks or extend life compared to medication and lifestyle management alone. So you have gone from feeling completely fine to a stress test, to a catheterization, to a stent, to a lifetime of blood thinners with their own bleeding risks. And you are statistically no better off than someone who simply took their medication and went for a daily walk. So what do I recommend instead? If you have no chest pain, no unexplained shortness of breath, no dizziness during activity, routine stress testing is looking for trouble in a population where trouble is common and intervention doesn't always help. Talk to your doctor about optimizing your actual risk factors instead: blood pressure, cholesterol, blood sugar, activity level, and sleep. That is where the real gains are. Checkup number 4. Routine bone density scan with automatic medication. Now, I know what you're already thinking. Dr. Sam, osteoporosis is real. Falls kill older adults. Of course, we should screen for it. And you're absolutely right. Falls are devastating. But here's where the logic breaks down. And it isn't the scan itself. It's the automatic pipeline that too often follows it. A DEXA scan detects low bone density. Your doctor prescribes a bisphosphonate, medications like alendronate or risedronate. You take them for years assuming you're protected. But here's what often goes unmentioned. Long-term bisphosphonate use has been associated with a rare but serious condition called atypical femoral fractures, spontaneous stress fractures in the very thigh bone you were trying to protect. These fractures can be severe and require surgery. Additionally, these medications are linked to osteonecrosis of the jaw, bone deterioration in the jaw that is painful, difficult to treat, and can be triggered by something as ordinary as a dental extraction. Meanwhile, the most effective intervention for preventing fractures in older adults, bar none, isn't a medication. It is fall prevention. Balance training. Studies show Tai Chi specifically reduces fall risk by nearly 50%. Removing tripping hazards from the home. Installing grab bars. Reviewing medications that cause dizziness. Getting your vision checked regularly. Ensuring adequate protein and vitamin D. These interventions reduce fracture risk more meaningfully than any pill, with zero side effects. So what do I recommend instead? Before agreeing to medication from a DEXA result, ask your doctor, can we review my fall risk factors first? What is the actual fracture risk reduction from this medication compared to a structured fall prevention program? You may find the answer surprises your doctor too. I'm not saying never take medication for bone health. There are patients who absolutely need it. But a routine DEXA leading to automatic long-term medication for an active 74-year-old who has never broken a bone? That conversation is worth having. Checkup number 5. Asymptomatic carotid artery ultrasound screening. This is the one I saved for last. And it's the one that, based on what the research actually shows, I consider the most quietly consequential of all. A carotid artery ultrasound checks the large blood vessels in your neck, the ones that carry blood to your brain. The idea is simple. If we find a significant blockage, we can surgically clear it out and reduce your stroke risk. Logical, right? The reality is far more complicated. And for patients without symptoms, it can be genuinely dangerous. Here is the key fact. The surgical procedure used to treat a carotid blockage, called a carotid endarterectomy, carries a 2 to 3% risk of causing a stroke during or immediately after the procedure. In older adults with other health conditions, that risk is higher. The United States Preventive Services Task Force explicitly recommends against routine carotid artery screening in adults with no symptoms, no mini-strokes, no vision loss, no neurological symptoms. Their analysis found that in asymptomatic people, the risk of surgical harm outweighs the benefit. Here's why. Many people over 70 have some degree of narrowing in their carotid arteries. It's been there for years, stable, silent, not causing any problems. When you screen for it routinely, you find it, and then a well-meaning surgeon recommends fixing it. But the surgery to fix a blockage that was never causing symptoms can dislodge a tiny piece of plaque that travels directly to the brain. I had a patient's family contact me after their father, a 79-year-old, perfectly independent, walking and talking, had carotid surgery following a routine screening. He went into that operation under his own power. He came out with a stroke that left him unable to communicate clearly for the rest of his life. The blockage they treated had been there for years, stable and silent. But the operation to fix it caused the exact catastrophe everyone was trying to prevent. So what do I recommend instead? If you have no symptoms of stroke or TIA, no sudden vision changes, facial drooping, arm weakness, or sudden severe headache, routine carotid ultrasound is not recommended. Invest in controlling your actual modifiable risk factors: blood pressure, which is the single biggest stroke driver, blood sugar, atrial fibrillation management, stopping smoking, and staying active. If you do have any neurological symptoms, even brief ones that resolved, get evaluated immediately. That changes everything. The 5 questions every senior must ask their doctor. I promised you something practical, and here it is. Every single time your doctor recommends a screening test, especially if you're over 60 and feeling well, I want you to have these 5 questions ready. Write them down. Put them in your phone. Bring them to every appointment from now on. Question 1. What is the false positive rate of this test in people my age? This tells you how likely the test is to trigger unnecessary follow-up procedures, even if nothing is actually wrong. Question 2. If this test finds something, what are the realistic treatment options for someone my age and health status? This forces the conversation toward outcomes, not just findings. Question 3. What is the procedural risk of any treatment we'd likely pursue? This is the question most people never think to ask. Every procedure carries risk. You deserve to know it up front. Question 4. What happens if we monitor this instead of treating it? For many conditions found in older adults, watchful waiting with regular monitoring is a legitimate and often superior option. Question 5. What is the most effective non-invasive intervention for this condition? Because very often, as with bone health, heart health, and stroke prevention, lifestyle and medication outperform procedural intervention with far less risk. Any good physician will welcome these questions. They will respect you more for asking them. And if your doctor dismisses these questions or makes you feel difficult for raising them, that is important information about whether that doctor is the right fit for you. Closing. I want to close with something I mean completely. There is a difference between medicine that finds things and medicine that helps you live well. After 60, the goal of your healthcare shouldn't be to generate findings. It should be to protect your quality of life, your independence, your energy, your ability to do the things that matter to you. The best doctors I've ever known understand that sometimes doing less takes more wisdom than doing more. That recommending watchful waiting can require more courage than ordering another scan. You have the right to know what a test is looking for. You have the right to know what happens if something is found. You have the right to ask whether a finding would actually be treated, and whether that treatment would genuinely improve your life. Medicine has given us extraordinary tools. But tools are only helpful when they're used at the right time, for the right person. You are that person, and you deserve a healthcare experience built around your goals, your values, and your body, not around a checklist. If this video gave you a new way to think about your health after 60, I'd love for you to do 3 things right now. 1. Hit the subscribe button if you haven't already. Every week I make videos like this one. Honest, practical, and grounded in what the evidence actually shows. Designed specifically for adults over 60. 2. Share this video with someone you care about. A spouse, a sibling, a friend who goes to every screening without ever asking why. One click from you might change the entire direction of their health. And 3. Leave a comment below. Have you ever had a routine test that led somewhere you didn't expect? Your experience matters here, and it might be exactly what someone else needs to hear before their next appointment. Take good care of yourselves. I'll see you in the next one. I'm Dr. Sam Hartley, and your health is worth fighting for.